everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia the Pharmacist. If you're new to this channel, a warm welcome to you. This is a channel where we educate ourselves on common health problems. We provide advice and information on health and well-being. So please consider subscribing. And as you subscribe, please remember to hit on that notification bell so you don't miss any video that I upload. To all our returning subscribers, thank you so much for joining me once again. Today, I've got a very interesting topic I want to share with you. We are going to be talking about chickenpox. You know, in healthcare, there's always some research going on, and these help us update our knowledge on the management of health conditions. So please do stay with me so you can update your knowledge as well. So today our highlight is going to be on lifestyle and home remedies for managing chickenpox. First of all, I'm going to give a brief overview of what chickenpox is, and then we would move on to the lifestyle and home remedies. Chickenpox is a condition caused by a virus called varicella-zoster virus. It normally causes an itchy rash with small fluid-filled blisters. Chickenpox is highly contagious to people who haven't had the disease or been vaccinated against it. It can spread through direct contact with a rash. It can also spread when a person with a chickenpox coughs or sneezes and you inhale the air droplets, and this would occur if you're in the same room with the infected person. Your risk of becoming infected with the varicella-zoster virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had the chickenpox vaccine. And it's especially important for people who work in childcare or school settings to be vaccinated. Most people who have had chickenpox or have been vaccinated against chickenpox are immune to chickenpox. But even amongst these vaccinated, a few can still get chickenpox. But then it is often milder with few blisters and mild or no fever. So now, who is at risk of developing chickenpox? People who are at higher risk of complications from chickenpox include newborns and infants whose mothers never had chickenpox or the vaccine, adolescents and adults, pregnant women who haven't had chickenpox, people who smoke, also people whose immune systems are weakened by medications such as chemotherapy or by a disease such as cancer or HIV. People who are taking steroids for another disease or a condition such as asthma. What are the signs and symptoms of chickenpox? The main symptom of chickenpox is an itchy blistered rash that appears on the skin 10 to 21 days after exposure to the virus, and this usually lasts about 5 to 10 days. Other signs and symptoms which may appear 1 to 2 days before the rash include fever, a loss of appetite, headache, tiredness, and a general feeling of being unwell. Once the chickenpox rash appears, it goes through 3 phases. So the first phase is characterized by raised pink or red bumps, and these are known as papules. These break out over several days. And then the second phase is characterized by small fluid-filled blisters, and these are known as vesicles. These form in about 1 day and then break and leak. And then the third phase is characterized by crust and scabs, which cover the broken blisters and take several more days to heal. You know, new bumps continue to appear for several days. So you may have all 3 stages of the rash. That is the bumps, the blisters, and scabbed lesions at the same time. and you can spread the virus to other people for up to 48 hours before the rash appears. And the rash remains contagious until all broken blisters have crusted over. The disease is generally mild in healthy children, and in severe cases, the rash can cover the entire body, and lesions may form in the throat, the eyes, and the genital area. So when do you have to see your doctor when you have chickenpox? If you think you or your child might have chickenpox, consult your doctor or your community pharmacist. A pharmacist or doctor usually can diagnose chickenpox by examining the rash and considering other symptoms. Your doctor can also prescribe some medication to lessen the severity of chickenpox and treat complications if necessary. In rare cases, if unresolved within a few weeks, there can be complications like dehydration, pneumonia, and you can check out my video on pneumonia if you haven't yet seen it. I'll leave the link in the description box below. Chickenpox complications can also include birth defects when pregnant women are infected. It can bring about bacterial infections of the skin, the soft tissues, the bones, the joints, and the bloodstream. So it is very important that you manage chickenpox very well and report immediately to your doctor if you think the symptoms are getting worse. So our highlight for today: lifestyle and home remedies. To help ease the symptoms of an uncomplicated case of chickenpox, follow these self-care remedies. Number 1, drink plenty of fluids. Try ice lollies if your child is not drinking to avoid dehydration. Number 2, avoid scratching. This is very important as it can cause scarring and slow healing and increase the risk of the sores becoming infected. If your child can't stop scratching, cut their fingernails and put socks on their hands at night to stop them from scratching. Number 3, relieve the itch and other symptoms. The chickenpox rash can be very itchy and broken vesicles sometimes sting. These discomforts, along with fever, headache, and fatigue, can make anyone miserable. To get some relief, try a cool bath with added baking soda or uncooked oatmeal and pat the skin dry with a towel instead of rubbing. Apply cooling creams and lotions such as calamine lotion or aqueous calamine cream on the spots. Eat soft, bland diets if chickenpox develops in the mouth. Antihistamines such as cetirizine, loratadine, chlorpheniramine can be bought over the counter from your local pharmacy, but make sure you speak to the pharmacist to make sure these are suitable for you or your child to take. Take paracetamol if there is fever, and dress in loose clothes. Now I want to talk about some precautions that you need to take when you or your child has chickenpox. And the first one is, don't give aspirin to children and teenagers under the age of 16 who have chickenpox, because it can lead to a serious condition called Reye's syndrome. Talk to your doctor before you give any type of non-steroidal anti-inflammatory drug such as ibuprofen to someone who has chickenpox. Some studies suggest that this type of medication may lead to skin infections or tissue damage. Number 2, do not go near newborn babies or pregnant women or people with a weakened immune system, as chickenpox can be dangerous to them. And number 3, get in touch with your doctor if the skin around the chickenpox blister becomes hot, red, and very painful. If your child has chickenpox and is dehydrated, if the chickenpox symptoms suddenly get worse, and you're pregnant and have not had chickenpox before, or you are not sure you've been near someone with chickenpox. If you have a weakened immune system and you have been near someone with chickenpox, or if you think your newborn baby has chickenpox. So today we have spent some time talking about chickenpox. We have talked about the symptoms of chickenpox. We have also talked about lifestyle and home remedies that you can carry out to manage chickenpox so as to avoid the complications of chickenpox. We have also looked at some precautions that you can take when you develop chickenpox. I hope you have learned something new today. Please give this video a thumbs up. Share with your family and friends. And if you haven't yet subscribed to this channel, I'll be very grateful if you hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.